the 2015 Conference on Retroviruses and Opportunistic Infections, Dr. Ronald Baldessari spoke with Dr. John Ward, Director of CDC's Division of Viral Hepatitis.
Hello, this is Dr. Ron Baldessari reporting from CROI 2015. I'm delighted to be joined by my friend and colleague, Dr. John Ward, who heads up the Division of Viral Hepatitis at CDC. Welcome, John.
Nice to be here, Ron.
I know this year we have a lot of presentations at CROI related specifically to hepatitis C. Can you share with our viewers what you think some of the really important messages are related to the science being presented here?
Well, first of all, it's just very heartening to see the increasing interest in hepatitis C at meetings like CROI, where you can get the experts in management of chronic viral infections such as HIV now pointing their interest in resources and capabilities toward hepatitis C. What's very exciting about what we're seeing at CROI is the continued good news about the effectiveness of these treatments. That regardless of whether someone's infected with only HCV or also infected with HIV, these new medications are equally effective regardless of whether that person has very advanced liver disease such as cirrhosis or milder disease. And it's just continued good news about what we can now offer patients who are living with hepatitis C to improve their health, but then also improve the public health at large.
Great. So, John, I know that you have been a leader at CDC in trying to raise awareness about viral hepatitis, both among healthcare providers and also among people who are living with or at risk for viral hepatitis. Can you share with us some of the efforts that are underway to increase this awareness?
Well, we just released the second version of our national education campaign, No More Hepatitis, with an emphasis on the NO of the KNOW, recognizing that many people aren't aware of hepatitis. We're obviously most interested and concerned about those who are living with this silent infection because this virus attacks the liver very quietly until the very late stages of liver disease. So that's why it's very important to get people tested. And so we're making a renewed focus on that.
Good. And I know that there have been some important information from CDC scientists presented here at CROI related to the impact of hepatitis C. Do you want to share with the viewers what that information entails?
Well, a key mission for CDC is to bring information to the table so that people can make the right decisions at the health system level or for the individual patient. The great majority of people that we're recommending to be tested, who have already been tested, have evidence of moderate to severe liver disease. And that's a real red flag. That means they're already having substantial health issues and that they are recommended to receive immediate treatment.
Sure. And to break that down for our non-medical viewers, that basically means they need to get into care.
They need to get into care now.
Yeah. Okay. If you could share with our viewers one message about viral hepatitis in the United States, and I know there are many, but what would that one message be that you would like to share?
Hepatitis C is an urgent public health issue. We have an increasing number of people becoming infected today. We have an increasing number of people dying of hepatitis C unnecessarily in the era of now curative treatment. So we need to we need to work together to spread the word about the seriousness of hepatitis C, the importance of people who are at risk for hepatitis C, such as persons born between 1945 and 1965, to be tested, and if they're infected, to be linked to a care provider that can evaluate whether they need treatment now and what else can be done to protect their health.
Great. Well, we certainly appreciate all of your efforts and the hard work of you and your colleagues at CDC to help break the silence around the silent epidemic of viral hepatitis. This is Ron Baldessari reporting from CROI 2015.
For more information about the conference, visit www.CROI2015.org. And for more information on federal HIV programs, visit AIDS.gov.